Everybody. Sorry I haven't done a vlog in a couple days, but I thought I'd hurry and do one before I had to go back to the hospital to see my husband. I'll do 2 vlogs, one for the surgery day and one for yesterday. This one's for the surgery day, so it's vlog 1. We got to the hospital at 9:30 in the morning, and we were in the waiting room for 5 or 6 minutes. They took him in, got him prepped for surgery, meaning by taking off his clothes, jewelry, glasses. He couldn't have anything on him. He couldn't have any valuables in his thing besides some clothes. The nurse talked to us about some stuff, signed papers. Then another one came in, which was the one that was going to call me every 2 hours. It could be on the dot or more or less of updates of what was going on. So she took my phone number and my name. Her name was Megan. And then the anesthesiologist came in, told us what he was going to do, from Sam's pain tolerance down to when he was going to put him under and what he was going to feel after and before. And he was a nice guy. And then Dr. Hunt came in and told us that what he was going to do again. We had one concern, that we wanted the mobility of his Sam's tongue, and it kept on saying like they were going to take the graft from his leg. But he clarified that he was going to take it from the arm, but the graft from the leg was going to go to the arm, which he did. And I went back in the waiting room, and it was like, I think 10:30. They called me. They started his surgery at 9:15, so he's in surgery. And we waited, and we figured out there was a TV there in the waiting room that had colors and like little worm-looking things like graphs. And we figured out that was the surgeries, and Sam was the top one. He was a pink salmon. He was in the operating room, I said. And then my family went to eat, and then my sister and I, we always kept one person in the waiting room at all times. And my sister and I went to eat, and came back, and they got another phone call saying his vitals was good. Everything was looking good. So far. And then a little while went by, and I went and got something for lunch, because between food and just walking around, that's all I did that day. And we got another call. Back. That was a little bit of somewhere, I can't remember. But they called us that they were stitching him up. Everything went good. The doctor will be out to talk to me about what he did and what he saw and what he found. So that was great. Waited for a little bit, and then Dr. Hunt came out and told us that the tongue was a nice clean cut, it sounded like, and the muscle in your tongue was still intact, so that was in his favor, because he wanted mobility and less speech impediment. The skin graft went great. It was on there beautifully. Here, what was it? Here is where it is. It's on his left side. This is all on his left side. Here, they took a nice incision right here. The windpipe's right here. But they took a nice incision right here and took 3 of his, what the hell is it called? Gland things. All those gland things. He took 3 of them out. And that his vitals were great during the whole procedure. He was doing wonderful. And that they just finished him up, and that he'd be in the waiting room for his room, and they would come and get me and tell me what was going on, but he'd probably be in a room, which he gave us a number, which I'm not going to give you. Unless you're really good. No, I'm joking. Yeah, that's what happened. We waited and waited after he left to finally hear what was going on. And one of the nurses came out, and she said that they were having trouble getting him in the room because they had to switch patients around, get rooms cleaned. So my mother-in-law left before that because she couldn't handle it. She did so good with her back. My parents and that had to leave because it was snowing. Yeah, Thursday, really good. And they let me back there with my mom. My mom was holding my hand because I was thinking all these tubes, everything coming out, but when I got to him, he had one little, like, tube right here with the windpipe thing to keep the moisture going, and little bandages here, but he was swollen. His tongue was swollen, so his mouth was open. He was like a little frog, as I called it. I still called it a frog. And he was looking good. They let my sister and dad come back to say goodbye, and they went home, and I waited until he was in the room so I made sure he was fine for the night, because he kept on telling me, you can't live in the hospital room 24/7 because I'm there. You need to go home, take care of yourself. And which I believe people, they're in the hospital being treated perfectly with nurses and all that, and they're getting the care, but you, on the other hand, you need to make sure that you're healthy, and you make sure you get yourself some sleep and everything that, because once they come home, you're going to be the nurse, and you're going to be that. And I have 2 kids to take care of at the same time, and it's going to be hard to try to keep the house clean and, you know, get meals prepared for them. But, yeah, he didn't get in his room until 8:30. 8:30 at night. I was in that hospital for 13 hours. Not visiting anybody, waiting for signs, and that is a long time. And I thank my parents for being there, and my sister. I wouldn't have been able to do it on my own. I would have gone crazy. There was people there that was doing it on their own with their spouse, and I just was like, oh, I don't know how they could do that. I have a little voice because I've been talking so much to a lot of people. It's a little, you know. But that's how Thursday went. So it was good. It was good so far. You know, I hated leaving you. I think I had a good cry in the parking lot at the hospital, because it was like, how do you prepare yourself to see your husband with cuts and swollen? And if it was something like minor on the other parts of the body, I think I would be fine. But it's up here. This is scary, because that's by his windpipe, you know. It's scary. I cried really good. I came home to an empty house. No kids. No husband. That was hard. I had to leave a light on because it just doesn't feel like home without my home. Does that make sense? My home is my family, not the building I live in. They make the home. And I love my little ones. I love Sophie and Kieran so much. Mommy loves you guys, and I love you, honey, and you're doing such a good job. He's my ninja. My superhero. Then that's how his surgery day, which is Thursday, and this is the video for that. View, subscribe, comment, and everyone who's going out with who's out there is going through cancer. I know how you feel. You have support out there. Use it. Get help. If you have friends who want to watch your kids, let them. If they want to make meals for you, let them, because it takes less stress off of you, and you need all the support you can get. And make sure you take care of yourself and your patient. So, love you guys.